Assalamu alaikum everyone. My name is Iraj Fatima and today I'll be presenting a very interesting and rare veterinary case titled Amorphus Globusus and a free Martin heifer calf. This case was reported in the Journal of American Veterinary Medical Association in 2022 by researchers from University of Saskatchewan. It describes a unique situation where a dairy cow gave birth to a healthy heifer calf along with a malformed mass called Amorphus globusus. Through this presentation, I'll take you through the case history, diagnostic findings, laboratory results, and the scientific explanation behind this rare developmental anomaly. So, let's begin. The Holstein cow was successfully bred by artificial insemination during her first lactation, and pregnancy was confirmed at various stages by transrectal ultrasonography. At 278 days of gestation, she delivered a normal, full-termed 40-kilogram heifer calf. Soon after, she expelled a strange mass weighing half a kilogram. This mass was rounded, smooth, and mottled pink to red in color. Fetal membrane were expelled 2 hours later, indicating a complete delivery. The cow herself recovered normally and was examined 7 days postpartum, showing no reproductive complications. The live heifer calf appeared normal in general condition but had distinct abnormalities of the external genitalia. There was a prominent tuft of hair located just below the vulva and a small slit-like vulvular opening, and a short anogenital distance measuring only 5.8 centimeters, smaller than the average of 7 centimeters reported for normal heifers. A lubricated probe could not be inserted through the vulva, suggesting a narrowed or incomplete vaginal opening. Initially, the calf was retained for observation, but at 33 days of age, it was humanely euthanized with owner's consent to allow a complete necropsy and detailed study of the reproductive tract. Expelled mass measured about 20 by 15 centimeters. On cross-section, it contained multiple empty cavities resembling the chambers of a ruminant stomach. Some areas contained fatty tissue, skeletal muscle, and bone. A primitive eye-like structure and patches of hair were also seen. However, there were no organized organ systems such as a heart or brain. Based on these gross findings, the structures was diagnosed as Amorphus globusus, an acardiac, malformed fetus covered by skin and dependent on the co-twin for its blood supply. Histopathologic examination revealed that the Amorphus globusus contained testicular tissue with a well-developed seminiferous tubules lined by cytolysed cells and surrounded by clusters of Leydig cells. Other tissue sections showed a mixture of structures from different organ systems, including skin with hair follicles, skeletal and smooth muscle fibers, cartilage, bone, and segment resembling parts of gastrointestinal tract such as rumen and intestines. The absence of a heart is a pathognomonic feature of Amorphus globusus and classifies it as acardias amorphous. The necropsy of heifer revealed partial masculinization of the reproductive tract. The vestibule was narrow, only 2 to 3 millimeters in diameter, and ended blindly against a transverse septum. Above this septum were 2 small elongated structures resembling rudimentary seminal vesicles, tissue normally present only in males. The uterus had 2 separate horns that did not fuse into a single uterine body. Both ovaries appeared histologically normal with primordial follicles present. These features combined with external genital ambiguity confirmed the diagnosis of free Martinism, an intersex condition that results in infertility. Blood samples from the heifer were analyzed for karyotyping, revealing a normal female chromosomal pattern 60XX. However, molecular PCR testing targeting a Y chromosome specific gene showed a positive amplification not only in Amorphus globusus but also in the heifer's ovarian tissue. This confirms the presence of Y chromosome material, indicating that male cells had crossed over from the malformed twin to the female during gestation through shared placental blood vessels. Thus, Amorphus globusus was genetically male and the heifer was a free Martin carrying both XX and limiting XY cells. The pathogenesis of this case can be explained by the twin reverse arterial perfusion or trap theory. In twin pregnancies with extensive vascular connections, one fetus, which is called the pump twin, provides blood to the other, known as acardiac or amorphous twin. The acardiac twin receives deoxygenated blood, leading to severe malformations and lack of heart development. In this case, hormonal and cellular exchange between the twin transmitted male gonadal factors such as anti-Mullerian hormone and androgens to the developing female. This disrupted normal female sexual differentiation and produced a free Martin heifer. Such phenomena occur in roughly 1 out of every 3,500 Holstein pregnancies. To conclude, this report described a rare occurrence of free Martin heifer born with a malformed male Amorphus globusus co-twin. The findings emphasize the impact of placental vascular anastomosis in causing developmental abnormalities and intersexuality in cattle. This case also highlights the importance of using molecular tools such as PCR for early confirmation of freemartinism, since routine karyotyping may miss subtle chimerism. Importantly, the affected cow recovered completely and later delivered a healthy, normal bull calf, confirming that the condition did not compromise the dam's future fertility.